More than 3 million Americans could lose Medicaid coverage under a rule that landed earlier this week. That estimate comes straight from the federal government. Welcome to the Morning Medical Update Weekly Recap with Medical Economics. Today's Friday, June 5th. My name is Austin Luttrell, and these are the top stories in medicine this week. On Monday, CMS finalized its rule on Medicaid work requirements. Starting January 1st, 2027, most adults 19 to 64 who got coverage through expansion will have to clock 80 hours a month of work, school, job training, or volunteering to keep it. Some people are exempt. Pregnant patients, caregivers, and anyone disabled are considered medically frail. That last term, though, is doing a lot of work. To qualify, a condition has to significantly impair someone's ability to work, and CMS is leaving most of that call up to the states. Cancer and HIV advocacy groups say patients could end up proving over and over again that they're sick enough to be exempt, but CMS says that's not the intent. Most people won't have to talk to anyone, and the goal is incentivizing more people to work. CMS Administrator Dr. Mehmet Oz told reporters, "We're forgiving, but we're not foolish." CMS projects that more than 2.3 million people will lose Medicaid enrollment in 2027, with numbers rising past 3 million in the years that follow. The Congressional Budget Office puts it higher at more than 5 million people uninsured. Next, on Tuesday, President Trump signed an executive order calling for more oversight on artificial intelligence. AI companies are being asked to voluntarily give the government up to 30 days to review their most powerful new models before release. That's down from a 90-day timeline the White House initially proposed, but scrapped after the industry pushed back. As for what this means for healthcare, the order sets up a government and industry effort to track down and patch software security holes, and it aims rural hospitals as critical infrastructure that'll get access to AI-powered security tools. For now, though, nothing's mandated, it's all voluntary. It's also worth watching whether this signals more oversight is on its way. This is a pretty narrow move on its own, but it's also the administration's biggest move on AI after a year of staying out of the way. And there's already pressure building up from the healthcare side. The American Medical Association is pushing Congress for guardrails on AI chatbots, especially those used for mental health. And finally, a new survey from Drugwatch talked to 600 US adults and found that only 45% say they always read a medication label all the way through. The rest skim it or skip it entirely, and that shows up in how people actually take their meds. 46% have taken a drug more often than the label directs, about 44% have quit a prescription early once they started feeling better, and 61% have skipped the medication entirely because they were worried about the side effects. A couple other numbers really stood out. Only about 38% had ever heard of a black box warning, which is the most serious warning the FDA puts on a drug, and nearly half of respondents think over-the-counter medicine is automatically safer than a prescription, which is particularly dangerous because oftentimes the same active ingredient shows up in different forms in different products. For example, acetaminophen. People take it for a headache, then a cold, then something to sleep, and quietly blow past the safe daily limit. It's already a leading cause of liver failure in the US, and adverse drug reactions send more than 1.5 million people overall to the emergency department every year. But that's all for your weekly recap. As always, though, we want to hear from you in the comments. For anyone treating Medicaid patients, how are you preparing them for these work requirements? And on drug labels, what's one thing that you wish every patient understood walking in? But with that said, don't miss new morning medical updates every Tuesday, Wednesday, and Thursday mornings over at medicaleconomics.com, and I'll see you back here next Friday with the week's top stories.